It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells along with Jim Knox, and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Dallas-Fort Worth area that are really changing people's lives.
Exactly right, Grace, and we're going to start the show with an inspirational story. A Marine lost 125 pounds thanks to minimally invasive general and bariatric surgeon Preeti Malladi.
Before I met Dr. Malladi, I had gotten up to 447 pounds. Normal things that normal people can do that are in shape, I had a hard time tying my shoes. You think that's no big deal. It was hard for me to tie my shoes. You wouldn't believe this, but I used to be a Marine. And so I was always in shape, thinking everything was in shape. And just over the period of years, man, I lost it. I was an excellent basketball player. It got to the point where I couldn't play basketball no more. I stopped playing softball. All of that ceased. I lost out on just doing things with my kids, and that hurt. I came to a point in my life where I realized, man, I couldn't do this no more. And so it's just a lot of, embarrassment.
Roy is a great patient of mine that came to me after struggling with his weight for years and years. He had developed multiple medical problems, including diabetes, high blood pressure, and sleep apnea. And he actually told me that he had really lost hope in his ability to overcome this problem. And we discussed how bariatric surgery can really help him achieve his goals of weight loss, but also to be able to get rid of these other medical conditions. Well, what's interesting with obesity is that adipose tissue is also a hormonal organ, and it actually can affect other medical conditions and cause people who have predisposition to diabetes to get type 2 diabetes or have other medical issues. The fat actually can infiltrate certain organs and cause problems. And so when you perform weight loss surgery, you can actually not only lose the fat, but you're really affecting these medical conditions at their source. And so this is something I want people to be aware of, that helping resolve your obesity can resolve these other medical conditions.
I wish I had did the surgery years ago. I went from 447 pounds to now, I weighed in last week, I was 316. I went from a size 66 waist to now size 50. I'm no longer on my diabetes medicine, and now I feel rejuvenated again and coming back. It makes a big difference, man. And I just want to encourage anybody that's thinking about it, you need to do it. You need to do it.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
I didn't have Poland syndrome, but it was like it, where one breast is significantly bigger than the other. So I was like a B and a C. It affects everything. The way you dress, the way your wardrobe is, the things you can and can't buy. And as a woman, you want to be able to just go buy it because you like it and you want to wear it, not because of the way it's shaped or formed around your breast area. I just got tired of feeling like that, and I knew that after having a child, it still didn't change. I finally said enough is enough, and I went and saw Dr. Barnett.
Kayla was a special case. This was actually more of a reconstruction than it was simple augmentation. There was nothing simple about that case. She had vast asymmetry in the breast. Asymmetry means one's not the same size or shape as the other. In Kayla's case, this one never developed. And this one was what you'd call a tube sock. Elongated, hanging down. This one was barely there. Usually should have been a two-stage operation. And I told her going in that, I can do so much, but probably you're going to need another operation.
We talked about it and looked at the pictures, and the kind of surgery I needed and required with what I had should have been a 2-step, possibly 3-step operation. And what Dr. Barnett did was just a 1-step operation. And that's all it took.
I was able to, in one stage, create a matched pair. It worked out beautifully. It's been a year now, and she looks fabulous, and she's happy as a clam. Is it rewarding? Yeah, really is. That's a special case.
Dr. Barnett treats his patients like family. He will give you his cell phone number to make sure that you can always be in contact with him if you ever need anything before and after surgery. I'm happy and glad to know that I safely chose him. I've had no complications. You can't even see my scars. He changed my life forever. It was the best decision I ever made.
Dried plums, or prunes, are packed with polyphenols, a plant chemical that has been shown to boost bone density by stimulating your bone-building cells.
Having children can put a woman's body to the test with large amounts of weight gain, and losing it can be very challenging. Up next, we're going to see how Victoria lost most of the baby weight on her own, but with help from plastic surgeon Dr. Robert Wilcox, she regained her original shape.
I had 2 children in the last 4 years, which is wonderful. I wanted to, get back to my normal shape, and I, started looking into getting lipo and things like that, and so I found Dr. Wilcox.
Well, liposuction is still one of the most popular cosmetic procedures done nationwide, as well as in our own practice. My preferred technique is ultrasonic liposuction, and that has proven the test of time. It's been present for about almost 15 years. Rather than just literally ripping the fat out, the cannula or wand is made of titanium. It's about this length. It has a hollow bore down the middle for suction. The tip of it vibrates over 20,000 times a second, and that's how it gets its name, ultrasound. And so we can just go back and forth gently until we can get about 2/3 of the thickness of the fat removed.
So I came in, told Dr. Wilcox that I would like to slim down around the hips, look at some areas of the stomach where the fat wasn't coming off. So he explained to me, he showed me what all he could do and what the result would look like. I was pleased with what his expectations were.
First of all, during the consultation, I make clear to them the best thing about coming to our practice is they're going to get the straight story. There are many patients every week who come in where I explain, I don't think the surgery's for you. We may be able to offer a non-operative measure, or maybe they just need the encouragement to realize they don't have the problem that they perceive in the mirror. In Victoria's case, she came in requesting the breast enhancement and liposuction, so we looked at her and looked at the common areas that are usually done. And she has a nice figure, and she was close to her ideal weight, but she had enough fat on her hips and abdomen that we could help her with that and make a significant difference.
I'm extremely happy with the results. They've exceeded my expectations as well as my husband's expectations. It is a quick recovery for such a big result that you get. It's just very exhilarating because I just have me back.
Coming up next, hear how you get your digestive system back on track with probiotics during our Medical Minute.
All this and much more when we come back.
Best Stocks Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
I never had an experience as I had with any of the other MRIs I've had over my lifetime. I came here and I thought I was back at my own house, and the people were so welcoming and caring. What did I need that was extra? Was I comfortable? And I was never left alone.
Everybody.
Over here, they were very concerned with my state after the MRI was finished, so they have chocolate cookies, they have candy, they have whatever you want, water, or so forth and so on. Sit down and wait and rest. This is unusual for me as a patient. I'm really happy that the doctor and the radiologist found some specifics that made my procedures less than they would have been and much easier for everybody. So I'm very appreciative of Preferred Imaging and its staff.
Having that peace of mind was very important, because once I found out that I was going to stay off for just some time and I realized it wasn't like a rupture or something like really severe, that really like kind of eased the burden within me, and then I kind of can project and have a game plan as far as when I want to get back out there and start working out again and running. Gave me a lot of peace of mind.
Welcome to the Best Docs Network. In the studio, we're very pleased to be joined today by one of the top LASIK surgeons, not only in the Dallas-Fort Worth area, but in the country, Dr. Harvey Carter. Dr. Carter, thanks for being with us today.
Thanks for having me.
It's a pleasure. And now talk to us about how you started in this field.
I chose this field of medicine because I loved microsurgery, and I found that out very early in medical school. And ophthalmology is an incredible mix of microsurgery, laser surgery, and wonderful, wonderful technology.
And you did your undergrad at SMU. Did you always plan to come back to Dallas to start your practice?
Yes, that was my goal. I came to SMU because of the pre-med program back in the time that we went here, and then went to LSU Medical School in New Orleans. Then did my internship back here in Dallas and residency in Georgia, and then back here to Dallas again. So I love Dallas.
That's great. And you have a lot of ties to the community, very involved in the Dallas community. You're the official LASIK eye surgeon of the Dallas Cowboys. That has to be both exciting and very rewarding.
That's been an incredible journey, and I sort of fell into that.
Really?
Went to a charity event many years ago. And while we were there were a number of Dallas Cowboy players there. And one thing led to another. And first, Tony Casillas' wife came in and had LASIK surgery. And then Tony Casillas came in and had LASIK surgery. And then I think it's like 50 or 60 Cowboys over time came in and had LASIK surgery.
That's so fun. And what would you say sets your practice, Carter Eye Center, apart from other eye practices in the Dallas-Fort Worth area?
I really think it's personal service and high technology. patients, I think, are looking for personal service, and at the same time, I think they're looking for high technology. They want the latest, greatest, they want the best.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
You hear a lot about probiotics nowadays. A lot of people take probiotics. In some cases that's good, in some cases it's not going to help much. Probiotics are microorganisms that people take and it gets in their intestines and populates their colon with the good kind of bacteria, like the lactobacillus, for example. There are lots of different kinds of probiotics, and in general, people that are healthy and are having no gastrointestinal symptoms don't need them. However, if you've had a lot of diarrhea, or let's say you have a lot of gas, either from the upper end or the lower end, or let's say you just have a lot of bloating and feel bad, probiotics may help you. Don't get the expensive brand name stuff over the counter, get the cheap stuff. Yogurt may work sometimes, but generally the probiotics that are over the counter are more concentrated than the yogurt. And it does repopulate your colon with the right bacteria and can help you with everything from gaseousness to diarrhea. That's a crowd pleaser. Go ahead and take it, it might help you.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
Don't forget, for more information about any of our outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com, bestdocsnetwork.com. You can even request an appointment. Now, Grace, we're going to move on to another story about a lady who now feels comfortable in her skin after losing a lot of weight.
Yes, Jim. Plastic surgeon Dr. David Azouz helped Karen remove an excess 8 pounds of skin after she lost 100 pounds. Let's take a look.
I had my gastric bypass in May of 2011, and after 2 years, I lost 100 pounds. After losing 100 pounds, I had a lot of excess skin on my belly. I've always been big around my belly area, so that's where I carried all my weight. I felt very unhealthy with it and wanted it removed.
The problem is when you lose that much weight, your body and your skin cannot go back to where you would like it to go back without help. And there's no way with exercise that you can get rid of the extra skin that's hanging, that has been stretched out, often has a lot of stretch marks. And in some patients, you do need to do a brachioplasty or remove skin from the arms. In some also you need to do a breast lift. In some you have to do a facelift to correct the extra skin around the face. So everyone's a little bit different. In Karen's case, her major problem was her abdomen, where she had all this extra skin and this pannus that she wanted removed, that she could not get rid of, despite the fact that she ate well and despite the fact that she was working out regularly.
When I came to see Dr. Azouz, I weighed 151, and that was because I was still carrying all the fat that was around my belly. He had explained to me the different procedures that he has. He explained to me the tummy tuck in particular. It was what I was interested in. When he examined me, he found a hernia, which he repaired while he did my tummy tuck. Dr. Azouz cut off 8 pounds of fat from my belly.
And of course, her skin was very poor quality. It was all had been stretched out from when she was a size 24 or 26.
Once I had my tummy tuck done, I dropped like 4 sizes right away. Dr. Azouz told me when I had the tummy tuck, I would lose another 20 pounds plus what he cut off. And I did. I started at 248 before my weight loss, and after my tummy tuck, I'm now at 124, size 0.
Still to come, hear how pain management specialist Dr. Jason Williams keeps his patients pain-free.
All this when we return.
Traditional MRIs cost a fortune and are uncomfortable, usually done in small, cold hospital rooms. But you have a choice. You can have your imaging done at Preferred Imaging in a comfortable environment with superior staff and technicians that make it simple and stress-free. Even better, Preferred MRI costs 2/3 less than the traditional hospital MRIs. And with 18 state-of-the-art locations, it's easy to find one near you. Call now to find out how you can save on any of your imaging needs. Preferred Imaging. Imaging made easy.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Hello everyone, we're in the studio today with one of the top facial plastic surgeons in the Dallas-Fort Worth area. It's Dr. Yadro Ducic. Thank you for joining us today.
Thank you for having me.
Of course. So you're double board certified. Tell me a little bit about what other areas you specialize in.
Well, I do a fair amount of reconstructive surgery as well, so we deal with a lot of facial trauma patients, head and neck cancer patients, skin cancer patients, and it's a lot of those folks you're removing parts of their face and then reconstructing and rebuilding them, and it really kind of flows nicely into cosmetic surgery because you're doing similar sort of things. It's all about making people feel better about their appearance and function better.
So tell me, Dr. Ducic, you have a unique philosophy, and tell me what your goal is with patients.
Well, I hope it's not too unique. I'd hope that most facial plastic and plastic surgeons felt the same way, but you know, by the time a patient comes to see you, for whatever the problem is, whether it's a crooked nose, a mole on their chin, a weak chin, loosening of skin, whatever the issue is, they've thought about it for a long time. They've looked in the mirror, they've critiqued themselves. Sometimes they've even shed a few tears. And so the last thing we need to do is to make them feel more uncomfortable about other things. And so I think it's important to address what their concerns are, recommend procedures or surgeries if they're appropriate, and reassure them that they'll do fine even if they don't have anything done. Because the most important thing you want is for them to walk out of the office feeling good about themselves. And the most important thing we want after surgery or procedures is for patients to feel good about themselves. The last thing we want is to create more anxiety by pointing out other flaws, which all of us have. That's what makes us human.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
For some people, having the perfect smile is all it takes to boost their self-esteem. Right now, let's hear from prosthodontist Dr. David McFadden on one of his tailor-made smile makeovers.
My specialty of prosthodontics really is the plastic surgery of dentistry. And in order to have a successful outcome, we want our patients to look beautiful and refreshed like the plastic surgeons do, but we don't want anyone to focus on why that is. And my specialty of prosthodontics exists because we make people's smiles as perfect as possible. We make people's smiles perfect with veneers, crowns, or implants. Each patient has a tailor-made treatment plan that we execute to give them the smile they've always wanted. It's very profound, the effect that teeth have on a person's facial structures. Part of the aging process is that people lose teeth or they lose bone, and that changes their facial shape, and it makes them age prematurely. So healthy, beautiful teeth support the face, and that is a part of what we try to do. For our patients who are missing teeth, we certainly want to give them back a beautiful smile, but part of the process is giving back the fullness and the youthful appearance from having the soft tissues restored as well as the teeth. During our diagnostic phase, we try to identify the problems with each patient's smile. Some people's teeth are too long, some are too short, some are too narrow, some are too wide. So there's a variety of ways that we can fix virtually every smile. And part of the specialty of prosthodontics is to know the modalities that need to be employed to fix each patient's smile and make it a custom, beautiful smile. My approach to these treatments is that I want to partner with my patients to create a breathtaking, functional smile. And the end result is life-changing for them. But what I love is it's life-changing for me too. To see their reaction and to participate in that, it's life-changing for me as well. I think most of our patients who go through a smile transformation have greatly improved self-esteem. And that's one of the most satisfying parts.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs.
Hi, I'm Dr. Preeti Malladi. Did you know that gastric bypass can not only help you lose weight, but have a profound impact on diabetes? To learn more, please see my videos on BestDocsNetwork.com.
Very important for me to try to really understand the patient's pain from their perspective, not just the medical perspective that I have, the knowledge that I have. I want to get to the root of the problem. I want to get to what they've been through up to the point that they've met me. How many surgeons have they seen? How many procedures have they been through? How many medications have they taken? You know, where are they now? How is this affecting your life? How is this affecting your family life? It's all very important to me because if I can effectively treat this patient and help them with their pain, I can improve all those things in their life, from social to the work ethic to their daily lives at home. Even though I'm a physician, I'm also a patient. So I also want to keep in mind what it's like to be sitting in those patients' shoes.
We really do love getting to know our patients on a more individual, personal level in order to help them with their jobs, with their home life. So when Dr. Williams determines his treatment plan, we can make sure that they are taken care of, whether it's time off that they need or helping them get the right equipment, medications, so that their healing process is as smooth and comfortable as possible.
What I want a patient to remember after they're done having a surgical consult or after they've had a surgical intervention is how they felt the whole time they were here. What was the process like for them? Was it an enjoyable experience for them? From the point that they walk in the door to the point they leave. I want them to understand that I'm going to be there for them. I'm going to address their issues. I'm going to take care of them from the moment they meet me until the moment they're pain-free 6 months to a year down the road. Being a pain management physician as long as I have, I've really been able to impact patients' lives very significantly. I get a lot of hugs, I get a lot of tears, I get a lot of thank you cards, and it really impacts me significantly and make me want to continue to get up in the morning and do what I do for the rest of my life.
That'll do it. That'll wrap up another edition of the Best Docs Network, of course, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. The good news is, for more information about any of these outstanding doctors, head to the website, bestdocsnetwork.com.
And if you have a question, a comment, or a life-changing story, we love hearing from you. Just send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.